But one important fact often isn't clear in media coverage: some celebrities who have had a double mastectomy actually carry a genetic mutation that puts them at extraordinarily high risk of breast cancer. For the estimated 250,000 to 415,000 women in the U.S. with a mutation in their BRCA1 or BRCA2 gene, including Angelina Jolie, who grabbed headlines in 2013 when she had a prophylactic double mastectomy, the surgery can reduce their odds of developing the disease by more than 90%. The National Comprehensive Cancer Network, the organization that creates evidence-based clinical practice guidelines, has deemed prophylactic double mastectomy a viable option for women with genetic mutations. Related, 5 simple things that could cut your breast cancer risk. Recommends against CPM for women who are diagnosed with breast cancer in one breast and don't carry a high-risk mutation. Most breast surgeons agree with that advice. A recent survey of 601 breast surgeons revealed that, while 95% were comfortable performing CPM on women with BRCA mutations, just 34% were comfortable doing the surgery on women of average risk. In July, the American Society of Breast Surgeons issued a statement that CPM should be discouraged for average-risk women with cancer in one breast. I always mention contralateral mastectomy as an option, but if the patient isn't likely to benefit, I explain why I wouldn't advocate for that approach, says Dr. Sabel. But most patients who opt for it have already decided that's the route they want to take before they talk to a surgeon, even though the majority of them don't have any known mutations that put them at increased risk of breast cancer. 2 other factors probably play a role in women's decisions to have CPM. First, the surgery is covered by insurance. I believe it should be covered, but women would undoubtedly feel different about it if it weren't, says Shelley Hu Wang, MD, Chief of Breast Surgery at Duke University. Second, mastectomy and reconstruction techniques have improved, and it's easier to create symmetrical breasts if you do both sides at the same time, says Deanna Ade, MD, a breast surgeon and assistant clinical professor of surgery at the David Geffen School of Medicine at the University of California, Los Angeles. Many women are interested in a more natural breast appearance, minimal scarring and symmetry, says Dr. Ade. Related, my breast cancer diary and pictures. The risks and the rewards. When Jennifer Bolstad, a 40-year-old landscape architect in Brooklyn, New York, first learned she had cancer in her right breast, 8 years ago, she thought she'd have a mastectomy on that side only. My husband and I were going to start trying to have children, and I really wanted to breastfeed, she says. But when her doctor told her that the type of tumor she had, invasive lobular carcinoma, slightly increased her risk of developing cancer in the unaffected breast, she decided to have a double mastectomy and sacrifice her ability to breastfeed. I don't have any known genetic mutation, but I've watched 2 aunts get diagnosed with the disease and one die in her 30s. I didn't want to live in fear for the rest of my life, she says. Still, when I was pregnant with my son a few years later, I really mourned the loss of my breasts, and there have been consequences I didn't expect, like the fact that I have no sensation in my breasts, a common side effect of mastectomy and reconstruction. Most women who get CPM don't regret their decision, but studies show that many wish they had known more about the trade-offs before embarking on the procedure, says Dr. Hu Wang. It's important to understand, for instance, that women who undergo CPM don't have a higher quality of life, on average, than those who choose less invasive treatment options, and they may even have lower levels of physical well-being, according to a study by Dr. Hu Wang, because the surgery itself has side effects that can cause long-lasting problems. For instance, up to 1/3 of women have chronic pain after mastectomy with reconstruction, says Dr. Hu Wang. You can get infections, too, and non-healing wounds, she adds. Those factors might not change your mind, but you should be aware of them before you commit to the surgery. Having a clear grasp of the risks and benefits is especially critical for BRCA-negative women diagnosed with ductal carcinoma in situ, also known as stage 0 cancer, precancerous abnormal cells in the milk ducts, 31% of whom are choosing CPM, per a recent study, even though low-risk CIS can often be safely treated by doing nothing but getting regular mammograms to make sure the condition hasn't progressed, says Drive Huang. Mastectomy is a big price to pay for a disease that's unlikely to kill you, she notes. Kathy Bressler says the fact that a double mastectomy was far more invasive than a lumpectomy didn't worry her beforehand, but it ended up being a bigger surgery than she had anticipated. Immediately afterward, the skin on one of her breasts started dying. To save it, she had to lie for hours in a hyperbaric chamber filled with 100% oxygen every day for 5 weeks. Because the surgeon cuts your muscles to make room for the tissue expanders, which they put in prior to implants as part of the reconstruction, You have T-Rex arms at first, she adds, and my pain was extreme for the first 2 weeks. Mastectomy with reconstruction can require multiple, hours-long surgeries, each with weeks of recovery, spanning many months. In contrast, lumpectomy is a comparatively simple operation. We make a small incision, it carries low risk, and most women have an excellent cosmetic result, says Drive Sobel. However, most patients still require radiation. But Bressler has no regrets. Her post-surgical pathology report revealed 3 more tumors in her right breast. Her cancer also turned out to be triple-negative, a particularly aggressive subtype. My mammogram had been clean, and an ultrasound showed only the first tumor, she says. So I don't look at lumpectomy wishfully. I think the fear of another bout would have always been there, and now I just don't have that. Get more information at www.fitnessgrudge.com. Please. Don't forget to like, comment, share and subscribe to my channel.